welcome back to Fox 43 AM Live. I'm now here at the Holton Community Hospital with Christy Roush, Director of Radiology and Leadership for Holton Community Hospital. Good morning.
Good morning. Nice to meet you.
Great to have you here on the show with us today. I want to start with you a little bit, kind of talk about your background and what led you to a career in radiology.
What led me to radiology was being 14 years old and volunteering at a hospital and just placed in radiology by mere accident, and grew to love it based on the radiologists that I was around. My job was to go get film. Back then we had film, and I would hang it for them to read. And some of them were so gracious enough to spend time with a 14-year-old kid. And so I got to love anatomy and science. And initially that started my love for it. And then later in life, St. Francis became the school where I went as a student and into x-ray and ultrasound. And so as soon as I got done with ultrasound, a job came available. This was also, Holton Hospital was a clinical site for me. And so this was a place that I'd already known. And so once a job came available in Holton, I knew that that's where I needed to be. And I found out that there's nothing better than rural hospital care. I absolutely love working in a small town. I feel that we get to treat all patients like their family, and we get to advocate, and we get to spend time with them, and we get to really, I feel, make a difference in their lives. And that's why I probably would never, ever leave a rural hospital, just because of the care that I get to give each day.
I love that so much. And having such a passion for, a rural hospital, I know a lot of people, we have our preconceived notions about like what a rural hospital is, but from my experience, Holton Community Hospital kind of blows those preconceived notions away. If you would like to talk about what's available here at the hospital.
Yes, so I think that's something that a lot of patients or community members don't realize truly what we have here to offer. We have the best staff. We have every modality in radiology here. I'm excited that we have a new MRI machine that will be here. And so I think there's places that are out months and months to get in for an MRI. And I don't even know that people realize that just 20 minutes down the road, we'll be able to service them and help them with their needs. So we have the newest technology as far as mammography, and I don't even think Topeka or Kansas City yet have the newest machine on the market. And so I'm glad that our little community hospital can provide that highest quality of care to patients.
Truly amazing, what the technology that the hospital is able to offer. But you also mentioned a great staff. So I want to talk about a little bit of your staff a little bit. What's it mean to have such a powerhouse really here at the hospital?
I love it. It's so fun. We have such a great culture and relationship in our departments. I truly think that that's what sets us apart. We care about each other like we're family. We have high expectations and high quality standards, but we can still have fun. And we truly care about each person that walks through that door just like their family. And I think that's what sets us apart is people that come through the door are our family, and we value them, and I hope that they feel when they leave here that they were helped by family.
I love that. And I know that kind of relationship with coworkers isn't easy to develop at all. And a part of it, I understand that you recently led a group of employees developing this new vision statement for here at the Holton Community Hospital. Can you tell us a little bit about the initiative, what you developed and its kind of a significance to the area?
Yes, it was really important to have a roadmap to know where we were going as a hospital. We got out of COVID, and it just seemed like that was a whole horrible mess with morale, people feeling burnout, and we wanted to focus not on the negative things that COVID did, but how we could transform that, and that led to our culture. And with having a culture innovative, like an innovation with culture or a culture transformation, we needed to figure out where we were going as a hospital and how we could then grab all of our people that worked here to be on the same path and know where we were going. So we got a whole group of frontline staff members, from providers, nurses. We tried getting as many people as we could to help with that. And I feel that we came up with a great vision for the hospital, which is to deliver patient-centered care, leverage innovative technology, and collaborate with the highest quality specialty services to be Kansas's most trusted healthcare destination. And that's something that I thought was amazing to see all of our staff that came together to pick those points out as being the most important for where we were going and what was important for us. Because we have the best machines, we have the best providers, and we have the best staff, and I truly believe that.
It's wonderful. I really love your full circle story of, you having, learned here at the hospital to come back around to now being a director of departments, leading into a vision into the future for the Holton Community Hospital. It's fantastic.
Thank you.
Well, Christy, thank you so much for joining us this morning. It's been such a pleasure chatting with you, and thank you for guiding the future here at the hospital. I'm excited to see what comes next for you guys.
Thank you very much.
Of course, everybody, if you want to learn more, you can visit holtonhospital.com.